Cardiopulmonary resuscitation in dogs. Cardiopulmonary resuscitation, also known as CPR, may sound familiar, such as learning about it in school or first aid courses. However, CPR is not always performed on humans. It can be performed on dogs, and you might have to perform CPR in an emergency situation. CPR is a life-saving first aid procedure that includes artificial respiration and compression of the chest. CPR is used when a dog does not have a heartbeat or not breathing. This causes the oxygen within the blood to be a lot lower, which can cause the organs to fail, so it is vital to respond to the situation quickly. CPR may be needed if a dog is choking, being electrocuted, or drowning. Preserve life. Quickly assessing the airways will allow you to see if the dog has blocked airways. This is done by pulling the tongue forward out of the mouth and check the throat. If there is a foreign object blocking the airway, remove the object. If you cannot remove the object, the hind leg remover can be done. The dog needs to be stood up whilst you put your arms around the abdomen and push securely upwards behind the ribs of the dog. Once the object is removed, lay the dog on the side. Once the airways are unblocked, checking the breathing of the dog can be done by looking if the chest is moving up and down, and whilst listening and feeling if there is any breath from the nose and mouth area. If the dog is not breathing, check the heartbeat of the dog. This is around 120 to 160 beats per minute for a small dog and 60 to 160 beats per minute for medium to larger dogs. If there is no heartbeat, this is when CPR needs to be carried out. Performing CPR. Place your dog on the right side of its body, lying down on a level surface, shown in the middle figure. However, if your dog has a round chest, the dog needs to be placed gently on their back, shown in the left figure, and CPR needs to be carried out in the middle of the chest. When compressing the chest, for large dogs, both of your hands need to be interlocked, whilst with a small dog only one hand needs to be used. The chest needs to be compressed 2 times in the space of 1 second by keeping your arms straight. After 30 compressions, you need to close the mouth of the dog and give 2 breaths into the nose of the dog, shown in the right figure. After giving 2 breaths into the dog's nose, check to see if there is a heartbeat. If no heartbeat, repeat the procedure over again. Promote recovery. Calling the veterinary practice is important whilst carrying out CPR, as the veterinary practice will be able to take over and try and get a heartbeat. And even if your dog's heartbeat is back and is breathing, it is still important to take your dog to the veterinary practice, as it could be a sign of an underlying health issue.